Hello everyone, I am Rohit Vats and you're watching the new episode of Health Plus. Today we have Dr. SM Tuli with us, a doctor with over 6 decades of experience. And welcome to the show, Doctor, first. And I'm tempted to ask you, how was it to become a doctor when there were very few medical colleges in India? I think less than 20?
Yeah, at that time, there were roughly 14 medical colleges in the whole of the country, say from Calcutta to Lahore and from Srinagar to Madras, just about 14 medical colleges.
I read your book about aging gracefully. So, but is it that easy as it sounds?
Can understand what is needed for a long, graceful and healthy life. There are unfortunately certain families where the basic facilities are not available. Otherwise, people who have the basic facilities, I'm very confident if they follow a healthy lifestyle, almost every well-provided home will cross 8-0 standing on your own feet.
But then I see a lot of young people falling prey to, say, things like sciatica or bad bone mass density, or sometimes even falling prey to osteoporosis. Because a lot of people are suffering from these things.
I think the fault lies with us only. We must follow a healthy lifestyle, I think, and then one has to learn what is the definition of a healthy lifestyle. We must have adequate amount of proteins in the form of milk, egg, fruits, minimize the use of fat. I think there's a moderation of everything. Unfortunately, some people think that increased weight is a sign of health. No, increased weight is not a sign of health. The weight is proportionate to your height. It's very well calculated. It's all in the standard books. So if we can keep our weight within the advised or normal weight, most of us can lead to a normal life. Roughly, good food, which means adequate amount of milk products, proteins, fiber, starch. Avoid becoming fat, and then maintain your diet so that you can maintain a proper weight. The weight is proportionate to your height. 35 minutes of exercise every day and 7 to 8 hours of sleep. Let's not forget it. During the daytime, we are working, we are thinking, we are running from one place to the other. Body does have certain areas where are wear, tear, stress and strain. When we sleep, body has the potential to repair. So let's have a good sleep, 7 to 8 hours, so that the whole body repairs, regenerates, compensates for what has worn out during the daytime. Right. It makes a lot of difference. Now you will say 7 to 8 hours sleep, and that again in a comfortable place. As we grow through the journey, we learn what is comfortable bed for us, what is a comfortable room for us. But one thing is sure, that no sleeping place should have digits in it, should have screens in it, should have ringing communications.
डॉक्टर, बहुत सारे लोग कहते हैं कि सनलाइट, सनरेज अपने आप में एक बहुत अद्भुत चीज़ है जो आपको स्वस्थ रख सकती है. कैसे कितना सनलाइट एक दिन के लिए ज़रूरी होता है?
What does sunlight do? I think let's understand that. Sunlight, when it touches our skin, it stimulates the formation of vitamin D within the body itself. And vitamin D is so essential for the health of our bones. In our country, there are some myths, some pleasant myths, some little over-exaggerated myths, doesn't matter. But I think we learn. Most of us are trained, are educated that the sunrise are best early in the morning. It may be the best, but there is nothing wrong in sunlight during the daytime. Roughly we say 20 minutes of exposure to sunlight, at least 5 days in a week, provides you enough amount of vitamin D in the body.
We have gradually moved away from the ancient techniques that we used to do for our own well-being.
There was a wisdom, you see, I think our ancestors did provide us a lot of wisdom. But according to that period of living, food, communication, what the normal man was performing at that time. Today, the living conditions have changed, I think, and with the better understanding of the human biology, human physiology. You see, earlier, how were we knowing the human function? Only by looking at the patient.
Right.
Then it came X-ray, then came blood test. Today we can see MRI. So many other investigations tell us how our body is developing, how does it function best, what is the method of putting it in the best shape.
बहुत सारे लोगों को आजकल साइटिका की समस्या है ऑफिस में घंटों बैठने की वजह से, आप क्या सलाह देते हैं उनको?
देखो, सियाटिका जो है, इट इज़ नॉट ए डिजीज, इट इज़ ओनली ए सिम्टम. जब जैसे एक बात करते हैं हेडेक, मेरे सर में दर्द हो रही है, सर दर्द इज नॉट ए डिजीज, इट इज अ सिम्टम. इट कैन बी कॉज्ड बाय 1000 कॉजेस. सेम इज द केस विद सियाटिका. आप ये शब्द सियाटिका ले आए हैं और बैकएक लेकर आए हैं. लेट्स ऑल रिमेंबर, ऑलमोस्ट एवरीबडी इन द वर्ल्ड गेट्स ए सीवियर अटैक ऑफ बैकएक once in his life, which he cannot forget it.
Oh. So it's a common phenomenon.
It's a common phenomenon. So, in fact, most of the spine, joint, hip joint, shoulder joint pain can be taken care of by a suitable exercise if the person is not suffering from a disease in the joint. So, if somebody has a disease in the joint, infection in the joint, rheumatism, what we call inflammatory disorders in the joint, they require specific treatment. We broadly use the word non-specific pains when we don't find that there is a cause caused by infection, caused by rheumatoid disorder, caused by a metabolic disorder. Then most of the patient can be treated by suitable exercise, modification of food, and certain medicines. I don't think one should go into panic.
And you are talking about these symptoms, and when should we be aware and very careful about it? What are the basic symptoms that once you see it, you should be careful?
Yeah. One should become concerned about it. If you get weakness in your feet, you should be concerned. If you think your control of urine and stools is being affected, that's the time when we should be very careful. Go to the doctor, get the investigation done. And today, beautiful investigations are available. If you can go to a suitable center, within about 3 or 4 days, you can be sure what you have in your spine, what you have in your joints. In about 3% of patients, you may require something more than a non-invasive investigation, and that comes to tissue diagnosis. It's just less than 3%. Otherwise, we can know the diagnosis by the available investigative facilities available in the country today. We can do all this.
Is the chance of bone infection in the bone very common or it's rare?
It's not I won't say it is a common condition, but it is certainly more common in economically lowest strata of the society. And one of the common infection which bothers in our country is tuberculosis. Indian subcontinent is the world's capital for tuberculosis, for that matter. And unfortunately, majority of these patients start from the economically lower strata. But don't forget it. There is always a connection between haves and have-nots. Every well-provided home is being looked after by people who come from the lowest strata.
Women are more prone to osteoporosis or bone-related issues. So how truthful are these things?
I think your information is absolutely correct. Women are more prone to loss of calcium in the bones. And most of it starts around the age of 40-45. Menopause leads to a hormonal disturbance in the body.
Which is in between 45-48.
It can vary, but somewhere from 40 to 45 years, that's the time when women start losing calcium normally due to a hormonal disturbance which starts at the age of 40 to 45. And then their calcium becomes less. And that is the time, if taken care of, they should be supplemented with vitamin D as well as calcium and a suitable diet, they are able to get control.
And can it be reversed? Like bad bone
Yeah.
density can be reversed?
No, it can be reversed. Oh, sure, it can be reversed. Men get into this problem usually after the age of 65.
So doctor, I was just wondering that what are the symptoms of osteoporosis and when you should be really be wary of your waning bone health?
See, you are concerned about the health of bones vis-a-vis calcium and vitamin D. Again, we come back. The lowest socio-economic strata of the country, we still get loss of calcium, vitamin D in growing children, and that is what is called rickets. Again, a little beyond the growing age, say between 12 years and 30 years, we still have people from that very strata who get what is called osteomalacia. The bones start undergoing fractures without injury. And then the third
And you
variety,
don't even know about it.
they don't know about it. They will come to you with pain. They generally come with back pain.
But they don't know that
General
it's
pain.
already a fracture.
Yeah. They are generally, it starts as what we call hairline fractures. We also call them, there are names for it, insufficiency fracture without any obvious injury.
A lot of athletes
That is
suffer
a
due
stress
to it.
fracture.
That's
The athletes get stress fracture. The bone is not used to that stress, and then suddenly the patient has been put to that stress, and then they can get a stress fracture, which can be, in layman's terminology, we can call it hairline cracks. Now, the third phase is 40s and above. That is the time when you start getting the deficiency of calcium and vitamin D, vague pains in the spine, vague pains in the hip joint, and a stooping posture of the spine. The spine gets bent forward. We call it dorsal deformity. This is
So
what happens.
you start sitting
You
like
start
this.
getting that. But these are preventable conditions. I pray well-provided home should not get them.
So doctor, you always talk about aging gracefully and we have talked about it earlier also. What is your formula?
Any service done by anybody, any profession, done ethically is a service to the people, service to the society. But you will do that only if you are healthy. So sir, repeating again ad nauseum, self-wellness is not selfishness. Human animals learnt it now after COVID. We make a conscious effort to stay healthy, and that is not selfishness.
Self-awareness.
Mother is healthy at home, she is serving the people.
Right.
A teacher is healthy in the school, he teaches with pleasure, he derives pleasure out of it. I think any profession done ethically is a service to the people, service to the society, and any effort for self-wellness should be not considered as a selfishness. I think this is the whole philosophy. And then what are the basic requirements to stay healthy? 1, good food. 2, 35 minutes of exercise every day. 3rd, we should be able to sleep for 7 to 8 hours every day. And what is a healthy lifestyle? Certainly no tobacco at all. Certainly we should not become fat, obesity, and if you are fond of alcohol, it may be permitted as a social drink, occasional drink.
That too in moderation.
Not every day. Every day alcohol is an addiction. The man is addicted. He is not healthy at all. So these are basic things. Another thing important, I think we should all know, according to my height, what should be my weight.
Right now, the country is of young people. But in 30 years, the country is, all these young people are going to get into that older age bracket. So are we ready for that?
I think the country is ready. Don't.
No, I don't have any doubts about that. I just want to know.
It is true. I think a lot of change is taking place. And there are almost all educated families will be crossing 80.
Thanks a lot for your time, doctor. So on that note, we will come back with another expert in another episode. Till then, thank you.